You know those times when your pet, your usually sharp little buddy, seems a bit well off?
Hmm.
Like maybe not catching on as fast or struggling with stuff they used to find easy?
Yeah, it happens.
Well, it turns out there can be some, surprising reasons behind those little shifts. And today, we're going to dig into one that might be hiding under the surface.
We're doing a deep dive into hydrocephalus in dogs and cats.
Yeah,
It sounds like a big medical term, and it is serious, but just understanding the basics can be really helpful if you're a pet owner.
totally. And we've got some really interesting stuff here pulled from canine and feline hydrocephalus to help us along.
Right.
Our aim today is to really get what hydrocephalus is about, why it happens to our pets, and what can actually be done. But, keep it clear, keep it understandable.
Absolutely. No getting lost in jargon.
Okay, let's unpack this then. Hydrocephalus. Sounds intense, but let's start right at the beginning. What is it exactly in pets?
Okay, so at its heart, hydrocephalus means there's an abnormal widening or dilation of the ventricles in the brain.
The ventricles. Those are the fluid spaces.
Exactly. Think of them like a network of connected spaces,
Hmm.
normally filled with cerebrospinal fluid, CSF.
Right.
In hydrocephalus, there's just too much of the CSF,
Yeah.
and it makes those spaces swell up, expand.
Okay.
And this expansion, it can be symmetrical, pretty even on both sides of the brain,
We're not.
or asymmetrical, yeah. And sometimes it affects the whole system, all the ventricles, or sometimes it's just parts of it, usually near some kind of blockage.
So, if the brain's plumbing system gets clogged somewhere, things back up. Is that a fair way to think about it?
That's actually a really good analogy. And it's usually an active distension the system is actively stretching out.
Ah, okay.
Most often it's because of a blockage. We call that non-communicating hydrocephalus. The
Mm-hmm.
CSF just can't flow properly between the different chambers.
Makes sense.
But then there's also communicating hydrocephalus.
Okay.
That's where the fluid can move between the ventricles, but it isn't getting absorbed back into the body like it should.
Ah, so the drain is blocked, not the pipes themselves.
Kind of, yeah. There are these little structures, the meningeal arachnoid villi,
Yeah.
that act like drains, sending the CSF back into the bloodstream. If they aren't working right, you get a buildup.
Gotcha.
And the key thing here is that the body keeps making CSF pretty much constantly, no matter what the pressure is inside the skull.
Really? Even if it's already high?
Yep. So the production doesn't stop. And that's why sometimes you can see clinical signs, symptoms, even if the actual pressure inside the skull, the intracranial pressure or ICP, measures as normal.
Wow. Okay. That's important. It's not just about high pressure. Now, the source material mentions congenital versus acquired hydrocephalus. What's the difference there?
Right. So congenital means it's present right from birth. It usually comes from some kind of obstruction that happened while the brain was developing.
In the womb.
Exactly. The most common spot for this kind of blockage in animals is a narrow channel called the mesencephalic aqueduct. It can get blocked or narrowed if certain bits of the brain, the rostral colliculi, fuse together when they shouldn't.
Huh.
And it's interesting, things like prenatal infections, parainfluenza virus,
Yeah.
in dogs, for example, have been linked to this aqueduct getting narrowed, causing hydrocephalus.
So an infection in the mother could lead to this.
It's one possibility, yeah. And because this is all happening while the brain is still forming, it can really mess up the brain's overall structure.
Right. Makes sense. And acquired, that sounds like it happens later on.
Precisely. Acquired hydrocephalus develops after birth.
Mm-hmm.
It's usually caused by blockages too, but they can happen at different points in the system.
Like where?
Could be the interventricular foramina. Those are passages connecting ventricles,
Yeah.
or the mesencephalic aqueduct again, or the exits from the system, the lateral apertures.
Okay.
And though it's pretty rare, sometimes it's caused by the body making too much CSF. Like if there's a tumor in the choroid plexus, the tissue that actually produces the fluid. Oh, and the source is clear that an old term, compensatory hydrocephalus, isn't really accurate anymore.
What was that?
It used to describe when ventricles looked bigger because brain tissue around them had been lost. But true hydrocephalus involves problems from the fluid pressure itself, damaging the remaining brain tissue.
Got it. Okay, so when we're talking about hydrocephalus affecting our dogs and cats, obviously the nervous system is front and center.
Absolutely. It's all about the brain and the CSF flow.
Is there a genetic link?
There can be.
Ugh,
We know, for instance, that in Siamese cats, there's an autosomal recessive gene involved.
interesting. But how common is it overall? Do we know?
It's actually surprising, but the exact incidence, how often it really occurs, isn't well known.
Really?
That-
Why do you think that is, with all the vet tech now?
It could be a few things. Maybe milder cases just don't get diagnosed, or the signs get mistaken for something else.
Mm-hmm.
Plus, reporting might not be totally consistent everywhere, but we do know who tends to be affected the signalment. Both dogs and cats, obviously. But for the congenital kind, the one they're born with, it's more common in small breeds, and especially the brachycephalic breeds.
Those are the short-nosed ones.
Exactly. Like bulldogs, Chihuahuas, Maltese, Poms, toy poodles, Yorkies.
Okay, quite a list.
Lhasa Apsos, Cairn Terriers, Boston Terriers, Pugs, Pekingese too.
Wow.
And specifically for inherited forms, Yorkies pop up again,
Yeah.
and Siamese cats, like we mentioned.
Right.
And here's a really weird fact. Studies found that lots of perfectly normal, healthy adult beagles actually have enlarged ventricles, ventriculomegaly, but show no signs at all.
No kidding. Just bigger ventricles, but they're fine.
Entirely so, which is, yeah, pretty surprising.
Huh. And acquired hydrocephalus.
That can happen in any breed, dog or cat.
Uh-huh.
Doesn't seem to discriminate by breed.
It's interesting to see that breed list for the congenital type. If you have one of those dogs, this is definitely good info to have in the back of your mind. What about age? When do symptoms usually show up?
For congenital, you usually see signs pretty early, maybe a few weeks old up to about a year. But the source also notes that sometimes a dog might have the congenital form, seem fine, and then suddenly develop signs later on.
Really? Why?
It's not entirely clear why that decompensation happens, just something tips the balance.
And acquired.
That can happen at any age, since it's caused by other things cropping up later in life.
And boys versus girls? Any difference?
Doesn't seem to be. No particular sex predisposition noted.
Okay. So let's get into what owners might actually notice. What are the signs we should be looking for?
Right. Well, first off, with the congenital kind, especially in those little toy breeds, a pet might have it but not show obvious signs.
So it can be hidden.
It can be. And things get trickier because sometimes other brain or spinal cord issues can happen at the same time, like cerebellar problems affecting coordination or syringomyelia, that's fluid pockets in the spinal cord.
Yeah.
These can muddy the picture.
Okay.
And with the acquired type, the signs of whatever caused the hydrocephalus like a tumor might actually be more obvious than the signs of the fluid buildup itself. And here's a key thing. How bad the symptoms are doesn't always match up perfectly with how enlarged the ventricles look on scans.
So you can't just look at a scan and say, oh, this is a mild case or this is severe.
Not purely based on ventricle size, no. It's more complex. But let's talk about what owners report the history.
Yeah, what might they see day to day?
Behavior changes are big. Maybe the pet seems less aware, less with it. Trouble learning or forgetting training, like house training.
Okay.
Sleeping way more than usual, being lethargic. Sometimes more vocalizing, crying, or whining for no clear reason. And occasionally the opposite, being hyperexcitable or restless.
Wow, that's a real mix.
It is. Vision problems too. Maybe they seem blind or just don't see well. And seizures are definitely a potential sign.
Seizures, okay. Those are pretty wide-ranging symptoms. What about what a vet might find during an exam?
Physically, looking at the head, especially in young animals with the congenital form, the head might look bigger, more dome-shaped than normal for the breed.
Like a domed head.
Exactly. And that angle between the forehead and muzzle, the stop, might be more exaggerated. They might also feel that the skull bones haven't fused properly yet. Open sutures, or the soft spots, the fontanelles, are still there when they should have closed.
But you said those head-shaped things aren't always present.
Correct. You can have those features without hydrocephalus, and you can have hydrocephalus without those obvious head changes.
Yeah.
So they're suggestive, but not definitive on their own.
Got it. Anything else on the physical exam?
In some severe congenital cases, the eyes might point outwards, bilaterally divergent strabismus.
Both eyes pointing away from the nose.
Yeah. That could be because the eye sockets themselves are malformed, or it could be signaling a problem deeper in the brainstem.
Okay. And the neurological exam, what specifically are they looking for there?
Well, the onset can be sudden or gradual, and the signs might stay the same or get worse over time. You can see a whole range of brain dysfunction signs.
Like what?
Signs of cerebral disease, that's the main part of the brain. So dullness, sleepiness, that cortical blindness we mentioned.
Where the eyes look fine, but they can't see.
Right. Inappropriate vocalizing, maybe hyperexcitability again. If one side of the brain is affected more, they might circle towards that side.
Circling. Okay.
Gait problems are common too, like incoordination, clumsiness, ataxia.
Yeah.
Or they might be slow to fix their paw position if you knuckle it over decreased postural reactions.
I've seen vets do that test.
And seizures. again, can be part of the neurological picture.
Hmm.
With congenital hydrocephalus, you might see that downward and outward eye deviation, the ventrolateral strabismus,
Right.
checking their eye movements when the head is turned. The oculocephalic reflexes can help tell if it's just the eye socket shape or if the brainstem's involved too.
So it really presents in a lot of different ways.
It absolutely does.
Yeah.
And if the pressure inside the skull gets really, really high, the signs become critical.
Michael.
Super even coma, pupils might be tiny, like pinpoints, or wide open and fixed, not reacting to light. Loss of those normal eye movement reflexes. Weird breathing patterns. A very rigid body posture called decerebrative posture.
That sounds very serious.
It is.
Yeah.
And ultimately, it can lead to brain herniation, where parts of the brain get squeezed into spaces they shouldn't be. That's often fatal.
Wow.
And while, like we said, sign severity doesn't perfectly match ventricle size, generally, the worse the signs, the more enlargement you tend to see.
This variability is, well, it really shows how complex the brain is, how hitting different areas causes different problems. But here's where it gets really interesting for me. How all these different symptoms, like sleepiness and bad vision and circling, can all point back to this one root issue.
Yeah.
It's fascinating. How does that pressure actually do that, affecting such different things?
That's a great point. Basically, the increased fluid pressure inside those ventricles pushes outwards on the brain tissue all around them.
Okay.
And different parts of the brain do different jobs.
Right.
So if the pressure is mostly on the cerebrum, the main thinking part, you get the changes in awareness, behavior, maybe seizures.
Makes sense.
If it presses on the visual pathways running through the brain, vision gets affected, even if the eyes themselves are okay. Pressure on the cerebellum or brainstem, areas controlling balance and coordination. That's where you get the unsteady gait, the ataxia. So the location of the pressure dictates the specific symptoms you see.
That connects the dots nicely. Okay, so we know what it is, who gets it, what it looks like. Let's get to the why. What actually causes this fluid backup?
Broadly, we group the causes into congenital present at birth and acquired developing later.
Right.
Congenital hydrocephalus usually stems from various malformations that block that CSF flow during development.
Okay.
It might be an inherited thing, since we see it more in certain breeds.
Like the Yorkies and Siamese.
Exactly. Prenatal infections are another big one we mentioned. Parainfluenza in dogs, some coronaviruses in cats. Exposure to teratogens, things that cause birth defects during pregnancy. Brain bleeds from a difficult birth, dystocia, even nutritional issues like the mother not getting enough vitamin A, and probably other factors we don't fully get yet.
That's quite a list for the congenital side. What about acquired? What causes it after birth?
Acquired hydrocephalus is usually caused by something else creating a blockage later on.
Like what?
Things like brain tumors, abscesses from infections in the brain, various inflammatory diseases affecting the brain.
Inflammation itself can cause it.
Yes, including inflammation that happens after bleeding in the brain, maybe from trauma or some other cause.
So often, acquired hydrocephalus is like a secondary problem triggered by something else.
Very often, yes.
Are there specific risk factors, things that make a pet more likely to develop it?
Well, the source does mention that animals who have what's called compensated hydrocephalus.
Meaning they have it but no symptoms, like those beagles maybe?
Exactly. They have the enlarged ventricles on scans, but seem fine clinically. Those animals are thought to be at higher risk of suddenly showing signs decompensating if something else happens.
Like what?
Like if they get an infection or suffer some kind of head trauma, that extra stress can kind of push them over the edge, disrupting the balance they had.
Ah, okay. They're managing, but barely, and another hit is too much.
That's the idea, yeah.
Okay. So if a vet suspects hydrocephalus from the signs and history, how do they confirm it? What's the diagnostic process?
Well, first they'll think about other things that could cause similar signs, the differential diagnosis.
Ruling other stuff out.
Right, like other congenital brain problems, maybe metabolic diseases or toxins affecting the brain. Brain tumors or infections can cause high pressure too, and sometimes hydrocephalus is part of that picture. Same with head trauma, hydrocephalus can develop after an injury.
Okay, so rule out the mimics first. What about regular blood tests or urine tests?
Usually for straightforward hydrocephalus, things like a CBC, biochemistry, urinalysis, they'll likely be normal.
So not super helpful for diagnosing hydrocephalus itself.
Not directly, no. But they are important for checking for other underlying diseases that could be causing neurological signs or contributing to an acquired case.
Right, makes sense. So imaging must be key then.
Absolutely crucial for a definitive diagnosis. Stug X-rays might show some suggestive signs in young animals, with the congenital form.
Like the dome shape, the open sutures.
Exactly. Maybe a thin-looking skull. But really, the gold standard is advanced imaging. CT scans, or even better, MRI.
Because they show the brain itself.
Precisely. They give detailed pictures, slices to the brain, and you can clearly see if the ventricles are enlarged.
Okay.
Ultrasound can also be useful, especially in very young animals where those soft spots, the fontanelles, are still open. You can use them like a window to see the ventricles.
Non-invasively, too.
Right.
So advanced imaging is usually needed to be sure. Any other tests?
Sometimes a CSF tap is done, collecting a small sample of that cerebrospinal fluid for analysis.
A spinal tap?
Essentially, yes, though the collection site might vary. But you have to be really careful doing this if you suspect high intracranial pressure.
Why is that?
Because changing the pressure suddenly by removing fluid could potentially cause that dangerous brain herniation we talked about.
Oh, right. Yikes.
So caution is needed. If it's primary hydrocephalus, the CSF itself might look pretty normal. But if it's acquired, say due to an infection, then the CSF analysis might show signs of that underlying infection or inflammation.
Okay. Any other diagnostic?
An EEG electroencephalogram, which measures brainwave activity, can sometimes provide supportive info. Congenital cases might show specific patterns. Acquired cases are more variable.
So it sounds like a good neuro exam plus CT or MRI are the main ways to diagnose it.
That's generally the case, yes.
Okay, so once you have that diagnosis, what happens next? What are the treatments?
Treatment really depends on the cause, how severe the signs are, whether it's congenital or acquired.
Makes sense.
If the pet is really sick, or if surgery is planned, they'll usually need inpatient hospital care for monitoring and support. Milder cases managed with meds might be treated as outpatients. Nursing care is super important too, especially if the pet isn't moving much. Preventing pressure sores, keeping eyes lubricated, watching their breathing.
Basic supportive care.
Crucial supportive care. And owner education is vital. Owners need to know what to watch for any worsening in mental state, vision, behavior.
Good communication is key. What about surgery? You mentioned it.
Yes, the definitive surgical treatment is putting in a CSF shunt.
A shunt. What's that?
It's basically a tube system implanted surgically. It drains the excess CSF from the brain's ventricles to somewhere else in the body where it can just be absorbed.
Like where?
Most often the abdomen, the peritoneal cavity, sometimes the right atrium of the heart.
And when would you consider surgery?
Usually if medications aren't working well enough or if the meds are causing bad side effects.
Is it risky surgery?
It's a major procedure. And yes, there are potential complications. The shunt can get blocked. That's actually fairly common, maybe up to 50% of cases, and might need another surgery to fix it.
Wow, 50%.
It's a significant risk. Infection can happen too, though less common. And sometimes the shunt drains too much fluid too fast over shunting, which can cause the brain to sort of collapse inwards. That's very serious.
Okay, so it's not a simple fix.
Definitely not. And even if the surgery goes well, the clinical signs might not disappear completely. Any lasting problems often mean there was permanent brain damage before the pressure was relieved.
Right. Realistic expectations are important.
Absolutely. And of course, if the hydrocephalus is caused by something specific, like a tumor, then surgery to remove that tumor would be a major part of the treatment plan too, if possible.
Okay, so surgery is an option, a potentially effective but complex one. What about medications? Can drugs help?
Yes, medications are often the first line of treatment, or used long-term if surgery isn't an option. The goal is usually to try and reduce how much CSF is produced, or to lower the pressure inside the skull.
How do you reduce CSF production?
Corticosteroids like prednisone or dexamethasone are used a lot. The evidence on how well they reduce CSF production is a bit mixed, honestly, but clinically, many animals do seem to improve on them.
So they help, even if we're not 100% sure why.
Often, yes. Dosages need careful management and tapering. Then there are drugs called carbonic anhydrase inhibitors, like acetazolamide, sometimes used with a diuretic like furosemide.
Okay.
They aim to cut CSF production too, but you have to watch electrolytes closely and they might not work well long-term, plus side effects can be an issue.
Anything else?
There was some research on omeprazole, the stomach acid drug.
Really?
Yeah, it showed some potential in lab dogs, but clinically, in real patients with hydrocephalus, the results have been kind of disappointing. Mostly anecdotal reports aren't great.
Interesting try, though. What about drugs just to lower the pressure directly?
For acute severe pressure increases, vets might use osmotic diuretics like mannitol intravenously. It helps pull fluid out of the brain tissue quickly, but it's a short-term fix.
Like an emergency measure.
Exactly. Loop diuretics, like furosemide, can also be used short-term to reduce overall body fluid.
And obviously treating the underlying cause if it's acquired.
Absolutely critical. Antibiotics for infections, surgery, or radiation for tumors, whatever's needed for the primary problem.
Got it. Are there treatments you shouldn't use or need to be extra careful with?
Definitely need to be careful with IV fluids in severe cases. You don't want to overhydrate and make the brain pressure worse.
Right.
And the meds have precautions. Long-term steroids have well-known side effects, and stopping them suddenly is bad. Diuretics risk dehydration and messing up electrolytes, especially low potassium with furosemide.
So lots to monitor. Which brings us to follow-up. What kind of ongoing care is needed?
Constant monitoring is key. Watching for any return or worsening of the hydrocephalus signs, or signs of the original cause coming back, like a tumor regrowing. Owners need to be really observant.
What are the main complications to watch for long-term?
Well, the worst is brain herniation, which can be fatal. With shunts, you're always watching for infection or blockage, which would need more vet care, maybe more surgery.
Okay. And the prognosis? What's the expected outcome?
It really varies hugely. Depends on the cause, how severe it was when diagnosed, how well they respond to treatment. Some mild congenital cases that are stable can actually do quite well long-term, maybe just needing meds occasionally.
So it's not always a dire outlook.
Not always, no, but it can be very serious.
The range of treatments from meds to complex surgery really highlights how important getting that accurate diagnosis is in the first place.
Absolutely. You need to know what you're dealing with.
So for someone listening, someone who loves their pet, what's the main takeaway message from all this?
I think the biggest thing is recognizing those early, maybe subtle changes in your pet's behavior or abilities. Don't just dismiss them.
Be observant.
Exactly. If you see any of the signs we've talked about, the sleepiness, the training issues, vision changes, head shape differences, seizures, talk to your vet sooner rather than later. Early diagnosis and getting the right treatment plan started can make a huge difference in the outcome.
Right. Okay, so let's quickly recap our deep dive. Hydrocephalus in dogs and cats. It's basically too much cerebrospinal fluid building up inside the brain, making the ventricles enlarge.
Right. Caused either by developmental issues from birth congenital or by things like tumors or inflammation later on acquired.
We know certain breeds, especially small and short-nosed ones, are more prone to the congenital type.
And the signs are really varied: behavioral changes, vision loss, seizures, coordination problems, sometimes that dome-shaped head.
Diagnosis relies heavily on neuroexams and advanced imaging like CT or MRI.
Treatment can involve medications to reduce fluid or pressure, or surgery to place a shunt, and treating any underlying cause is crucial too.
And while it can definitely be serious, knowing the signs and getting veterinary help quickly is so important for these pets. You know, thinking about how complex that fluid balance is in the brain and all the different things that can throw it off,
Yeah.
it really makes you wonder how many other conditions we see in pets, things that seem totally unrelated, might actually have some surprising neurological link that we're only just starting to figure out.
That's a really interesting thought, the brain's connection to everything else. Yeah, it's incredibly complex. We're learning more all the time.
Definitely food for thought. Well, thanks for digging into this with us today. It's been really informative.
My pleasure. It's an important topic.
Until our next deep dive, everyone, take care.